Health Launchpad. We help technology companies navigate the healthcare market. This is episode 2 of the Health Tech podcast. This week, we are talking to Ed Gaudet, the CEO and founder of Censinet. Censinet is a really innovative risk management solution that's helping healthcare solution systems manage their vendors. So Ed, thank you for taking part today. So tell us a little about yourself and tell us a little bit about what Censinet does.
Sure. Thanks, Adam. So let's see. I've been in software all of my career. Started out in 1987, and I've been pretty much associated with helping companies start up and grow. And I've been fortunate to work with some really great products and great teams over the course of my career. Companies that have gone public. Most notably, I was at a company called Imprivata before I founded Censinet, and Imprivata basically provided a set of security and workflow tools to the healthcare industry. And it was the first time in my career that I'd ever been associated and worked with the healthcare industry, and I really loved it. So when I had the opportunity to start up another company, I connected with a co-founder, Keith Figlioli, who spent most of his career in healthcare as well. And he was coming out of a GPO, a group purchasing organization called Premier. And
know them well, yeah.
Yeah, you know them well. So yeah, so they basically help healthcare providers in their supply chain navigate contracts and agreements. And so he had seen this problem, and I similarly had seen the problem of managing third-party risk and supplier risk from both sides, right? From the provider side and also from the supplier or the vendor side.
Explain what that risk is. So, for
sure.
people aren't that familiar with that.
Yeah, absolutely. So if you've ever sold into healthcare, you're most likely familiar with the requirement to complete a risk assessment, a security risk assessment. And obviously that enables the healthcare provider and the risk teams to assess the level of risk that they're basically dealing with and maybe accepting to bring your product or service inside, right? So obviously, we just pick up the paper and you'll read about the breaches that occur, and it's getting worse, right? So the breach data year over year, is larger than any previous year, and the breach numbers continue to grow exponentially, which you would assume at some point would start to flatten out, right? So the curve for breaches, given the investments we're making as an industry in cybersecurity, should be leveling off, but they're not. They're getting worse, and they're getting much riskier. And so if you think about data breaches, on whole, they can be embarrassing, they can be inconvenient, they can be costly, but you sort of get through that if your data is exposed, right? However, if you're connected to a medical device or you're connected to some other application that delivers care, and that's critical for that care delivery and is critical for sustaining and supporting life, and that gets hacked or that gets attacked, that's a problem, right? Now that's about patient harm, that's about patient safety, and it becomes personal because that could be your father, your mother, your grandfather, your grandmother, your daughter, your wife on that system. And especially as we look at today and what's happening today with COVID-19, right? More and more people are relying on those life-sustaining medical devices. So this is a much broader problem that has certainly escalated over the last 5 years and has moved from simply the data that health providers manage on your behalf, your patient data, to actually those clinical applications, devices, and other things that are part of that care delivery system.
And I've heard that the security breaches have spiked during the coronavirus crisis. Are you seeing that?
We are certainly, in any time of crisis, you've got bad actors, right, that mobilize and try to take advantage of the situation, and everything from fraudulent organizations that are, selling personal protective equipment, right? So like face masks, or robes, or gowns, or gloves, to your traditional bad actors that are always trying to infiltrate your network and either take data out of it, or actually worse is to lock it up, right? And so it's one thing to lose data; it's another thing to actually lose it in the context of operational data, right? So what happens if my systems now are actually locked up due to ransomware? That's a real problem, because now I can't operate as an organization.
Are you seeing increases in ransomware?
Oh, we've seen pre-COVID, we've seen increases in ransomware, and it's significant because it's literally shutting down provider organizations. It's shutting down physician practices. It's shutting down ambulatory practices, care practices, because they can't come up with the money and pay the ransom. And it's a big issue across this industry.
What a nightmare! What a nightmare! And so, how you know what? Uh, when I talk to other health tech companies, I kind of see, in simple terms, they kind of fall into two camps right now. Those that are essentially kind of shut down by coronavirus because they just can't sell to their healthcare systems.
Mhm.
Healthcare systems haven't got time for them. And the others that are just their hair's on fire. That anybody in telehealth, remote monitoring is just going in, is insanely busy. They don't have time to talk to anybody other than their customers right now. Has it affected your business?
Yeah, like everyone else, we quickly assessed the situation. I put all employees in a remote status March 9th, so a little earlier than a lot of companies.
Yeah.
But I've got a couple of employees that have just recently had newborns, and they commute into the city. We're in Boston, and I just I didn't want to take any risks there. So we went remote as an organization pretty early.
Mm.
We're obviously learning from that. We've acquired certain tools, more licenses for Zoom. We
Yeah.
live on Slack, so we're pretty good. I mean, we talk on a regular basis. We're doing social events as well. We're just trying to stay connected to everybody and make sure everyone's safe and healthy, and B, we continue to move obviously the business forward. What we're finding from our customers is that they're continuing utilization of the product, which is great. We talk weekly with every customer, either for 15 minutes or longer, depending on the topic. We're constantly taking in input from them as well on the things that they're dealing with, and working to to try to extend the product in areas that we hadn't originally built it for. So, for example, I talked earlier about fraudulent, bad actors that were trying to scam dollars out of these healthcare providers, and we recently had a hospital call us up and said, "Hey, did you do anything here?
Mm.
We need to acquire PPE, and there are a number of bad actors out there." So we created basically a workflow and a risk assessment questionnaire that would give them a quick indication on whether or not it was a legitimate provider of PPE.
Wow.
So yeah, so those are things that we're constantly working with our customers on. We like everybody else, we looked really hard at where we were spending money, and for startups, cash is king and cash flow is critical, and
Oh yeah.
so, as you know, right?
Oh
So
yeah.
so we made the appropriate cuts. We have not cut any employees, and we currently don't have a plan to do that. And I mean, we're lucky, we're small,
Yep.
but we've done, and we acted quickly too. So that was able, that enabled
Right.
us to extend runway appropriately. But we're in good shape, and like I said, we continue to work with customers on as they roll out and deploy our solution. We just did a new deployment this week with a new customer, a hospital here in the Boston area. And what was great is they had they were spending significant money through using a third party to do these assessments, and we saved them, about 3x.
Wow.
Yeah. What you're finding is, and this is the real, interesting part of this, of this problem that we're solving, is that it's highly manual in nature, and everyone does it pretty much the same way. They're using spreadsheets, they're using emails and phone calls, or they're working with a third-party consulting group to basically offload the manual work. And some of these, groups will, put up sort of a tech-enabled service, but behind that is really a bunch of people doing the work, right? We take a very different approach to solving the problem, and I believe in automation. I've been, building solutions that automate manual processes all my career,
Yeah.
and so we're all about taking the cost out of the problem, taking the cost out of that process,
Mm.
and really, providing a solution that enables them to do their job, enables them to do it faster and with more coverage, which is a real challenge. Essentially, if you're, if you're governed by the number of resources and hours you have, right? So automation can do a really good job of extending that, and allowing you to cover more and more of your supply chain as it relates to risk. And then, lastly, this is not just a technical problem, but it's an economic problem. And so for us, we've taken a very different approach. We've created a two-sided network, effectively a marketplace, if you will,
Yeah.
that connects the providers with their supply chain of third-party vendors. And when you do that, you get some really interesting benefits. So as an example, from the vendor's perspective, I have to deal with all of these different assessments, different formats, different questions, whether they be contextual or different, the same question just asked differently. So there's a semantic challenge, right? And as a vendor, it's really difficult to get leverage based on the previous work I've done. So if I've seen one risk assessment, I've seen one risk assessment, essentially.
Yeah. Yeah.
What
Yeah.
what we enable the vendor to do is basically fill it out one time
Right.
based on their organizational risk, but also on their product risk or services risk, and then leverage that and reuse that across the network. And we call that
Right.
a one-click assessment, effectively. But that enables a vendor to leverage technology and automation to provide more transparency, right?
Yep.
I always like to say transparency is the enemy of risk, right? If you can provide that trusted network where things are much more transparent, you have a better chance of reducing risk overall. Not just in that isolated one-to-one situation, but as an industry. And that's what's really exciting to me is that, we think about it broadly. We think about the industry risk, not the one-to-one risk that a provider has with a particular, one or more vendors. We believe that as an industry, we have an ability to actually, reduce risk across the industry. And
Very.
and
Yeah.
and to me, I believe that will move the needle on breach data. That will move the needle on those organizations that are getting breached or having to deal with ransomware or having to deal with cyber attacks on medical devices or other devices within their organization.
Right, because you can constantly update it and have the vendors keep that updated. I just an observation as having been on the vendor side, it's a really powerful message because every time we'd be, responding to an RFP or going through the risk assessment process, as you say, you've seen one risk assessment, you've seen one risk assessment. And I would hate it that I'd have to go up to our CTO, who's an incredibly busy, hardworking guy, and ask him to spend 6 hours completing this form because, one particular healthcare system did it differently than the last one he did. Rather than focusing on what he really needed to be focusing on, which was, building out the product.
That's right. That
Incredibly
that
frustrating.
that's exactly that's correct. And that's what's exciting, right? Because now we can, and we see this happening, right? Now we find healthcare providers that are taking those, valuable resources that were stretched thin anyway, and having the opportunity to redeploy them into higher value areas of the business.
Right.
And that is, most important as we look at, what we're dealing with today, right? Everyone on the front lines, and God bless everyone that's doing this work today, is faced with helping out the hospital and the clinicians deal with the pandemic. And so, you know, generally things like, risk assessments would take a back seat to that. However, what we're finding is that they also have to acquire these tools and technologies that they weren't, considering previously, to now deal with this. And so there's still that matter of risk, and they still have to manage that risk in the context now of dealing with COVID-19. So we're seeing, I was obviously expecting that customers would slow down usage, which hasn't happened. I was also expecting prospects really to not return calls, which, has not happened. So
Hmm.
uh, the good news is, our business continues and people continue to be interested in really, again, not just acquiring technology for technology's sake, but really looking at ways that they can free up those resources internally, and but still continue the process of managing risk across the organization. Because again, it's one thing to shut down a particular process that may not be directly related to clinical care or patient care. It's another thing to get shut down because now you've been hit by a ransomware
Exactly.
attack,
So,
or your medical devices have been hit, and so now you cannot, you can no longer deliver patient care. So we still believe that there are core functions within a health system that still have to continue to operate.
what I'm starting to talk to a number of organizations that are looking beyond the current crisis. They're starting to think about how the world's changing, on how this is going to change their business and change the healthcare technology market. What are your thoughts on it? Where do you see this? What do you see as possible disruptions that'll really change, that'll make some fairly significant changes in what we do and how we do it?
Well, I think first and foremost, there's there's this notion of prioritization that's happening, right? And it's happening in real time for the industry. And so they're literally assessing things quickly, those things that they need to continue doing, those things that they can either delay or suspend altogether. So I think when we come out of this, the people will look at those things that really made a significant difference and those things that
Mm.
didn't, and they'll adjust accordingly. So I think that's, there's this notion of really understanding what I need to do to move my organization forward, whether it's a healthcare organization or a restaurant, quite frankly, right? And I think from a start, from the perspective of startups across, across the world, across the U.S., um, how they think about growth and how they think about managing their resources, their people, but also their cash, is going to change significantly as well. Um, so I just think that, we'll develop muscle memory from this, right?
Hmm.
Which we'll be able to apply in good times and in bad times. And I think people will just start to think differently about, overall operations, strategy, business, working with customers, et cetera.
That makes a lot of sense. So let's go back. I'm always fascinated about the backstory on any startup, and I remember we were talking a few weeks ago, and I thought your story was really interesting of how how the business evolved from an idea.
Mhm. Yeah. Yeah. So, it started off in July of 2017. Keith, like I told you, had called me, and we set up a coffee. We set up scheduled basically to meet for coffee and talk about the idea. And he had been thinking about this deeply for a while, and I had literally had just thought about it within the context of supplier risk across more than just healthcare. And we sat down and began to riff on the problem set. And I was really excited about leveraging his insight and perspective coming out of the GPO, and also my experience, even though it was limited in healthcare. Again, I spent previously that one company at Imprivata in healthcare, but I learned a lot, and I really enjoyed working with healthcare providers. And what I found coming out of that experience is that those relationships you build with CIOs and CISOs and clinicians within healthcare are very different than the relationships you might be building with
Hmm.
CISOs in finance, right? And or in manufacturing or in energy.
Why is that?
Yeah, I just think it's a different mission, right? So healthcare, it's the first time that I was able to tell my mother what I did, and she got it, right? And I'll give you another example. I broke my leg about let's see, when was that? That was in 2000 and it was actually in early 2017. I'd broken my leg before I'd started Censinet, and I was still at Imprivata, basically. And I went into my local hospital, obviously, and then I was sent to see an orthopedic surgeon, and I met with her, and I happened to have my Imprivata jacket on. And she noticed the jacket, and she looked at me, she said, Cortext. And that was a product that I had actually built. It's a secure communication and collaboration product. It was a cloud system. And my local hospital was a customer. And so she was using the product.
Mm.
And so we began to talk, and my wife was with me, and we began to talk about the product for 20 minutes. And my wife finally looked at her, and she said, "Are you going to look at his leg? Like, are you going to spend any time looking at his leg?" So that experience
That's so cool.
working with providers and clinicians on the front line,
Mm.
and where your technology was literally making a difference, was a
Yeah.
unique experience for me. And I really, I learned a lot from it. And again, those relationships are such that, when I started up Censinet, um, I immediately reached out to a bunch of CIOs I'd worked with, and I said, "Hey, help me validate this problem."
Yeah.
And they all said, "Yeah, we've got the problem." I talked about a dozen, across the U.S., different, large hospitals, small hospitals. And I said, "Great, help me design a solution that solves it. Help me really understand the problem deeply." And we began to set up a series of discovery workshops with these providers, and we really codified the pain, the problem, the workflows that were associated with the process as it existed manually. And from that, we were able to design the first set of requirements for the platform. It really, helped us get to an MVP much quicker than I have had, experience before, and subsequently to a version, to a release in early, well, actually, it was mid 2018. So less than a year, we got it to market with a solution, and then began to sell that solution. We sold into large hospitals, and small hospitals. So, our current customers are providers like Intermountain Healthcare in Utah, uh,
Wow.
Partners Healthcare, Cedars Sinai. We have small ones too. Dayton Children's is a small
Mhm.
customer. In a Bay State out in Western Mass. We sell and work with these customers again to solve this problem, and many of those early customers were also part of that design cohort that really helped me think through the problem and build the platform. And they continue to spend significant time with us, thinking through what else we can add to the product, what other things we can automate as part of that workflow solution.
That's
And,
the ideal way to start do a health tech startup like that, just to
yeah,
get your
that's right.
right.
And listen, this is a problem that exists largely across industries. So everybody's got this problem, whether it's
Mm.
a healthcare system, a hospital, a clinic, a manufacturing firm, energy, banking, obviously, and we all have to manage the risk that's associated with third parties that are managing our business processes. And more of those business processes are being managed through external third parties, whether it's a cloud system, whether it's a connected device, whether it's a mobile application. And technology continues obviously to evolve, innovation continues to evolve. And so, it seems like, every month there's something new out there that has to be thought through in the context of risk. If I bring in blockchain, what does that mean to my organization? If I bring in AI or machine learning, what does that mean to my organization? If I move this on-premise solution to the cloud, what does that mean in terms of risk? If I bring in this medical device and connect it to my network that's connected to the internet, that has now a mobile device or a mobile application associated with it, right? Now you start to compound those risks as solutions become multi-headed, right? It used to be that a medical device was deployed in a segmented network that you could manage. Now it's got an IP address. It can be deployed in many and configured in many different ways, and that increases your overall risk. And you've got to understand what that risk is, based not only on the device that's in the box, but also when you take it out of the box and you configure it and you begin to operate it across your network. So those are things that we help providers with, as
Now
they begin.
you've got some pretty impressive investors. Tell us a little bit about how you went about raising capital.
Sure. Well, again, I mean, it helps to have a co-founder that's a partner at a venture firm. So
Oh, that
again,
would help. Yeah.
yeah. So Keith so Keith's a partner at LRV Health, and that really helped, identify our initial syndicate, if you will, for the seed round, and from there, we raised last year. We raised a Series A round, which we've added people like HLM Ventures, that venture partners, and they've done things like Teladoc, right? So they've got some really
Yeah.
great experience, obviously in healthcare. We also work with in Cedars-Sinai is not just a customer; they're an investor, and they provide significant help, not just obviously on the product as a customer, but also as an investor in things like strategy and things like go to market, how we think about partnering, um, and obviously, that goes a long way with not just the near term requirements, but the longer term view of where we're taking the company.
Yeah, I think you're a template for the right way to do it. Yeah, I think it's very impressive.
No,
So,
I appreciate that. And we're helping those start. And another thing we're doing too, and this, you can't really get this from the website, but we're also working with the Mass Challenge and the high tech group that basically has is an incubator for digital health
yep.
organizations. And we recently made an announcement there where we're partnering to bring a standard set of risk questions that these startups can use on our platform. And we also spend time helping those startups really understand um, where to make investments early on, and then how to communicate those security programs and information security programs that they have in place and that they're building, right? Because you're a startup and you can't afford out of the gate to have a security posture like an Amazon or like a
Right.
Microsoft, right? And so, and we went through the process because we're a startup as well. So we actually used our product to really help us create a proactive and dynamic information security program. And I have a CISO on staff, and basically, he drives our overall security program and leverages our product to to work through our maturity as an organization and to manage the maturity of our security programs. And so we've taken all of that, and we're giving that back to those startups that obviously can get on our platform and manage their their risk assessments, but also to give them knowledge and give them templates and really help them prioritize what things to do first, those things that make the may not cost them a lot of money but have a big effect on how they communicate their risk posture as they're selling into healthcare and as they're working with providers that are assessing risk. We help them, bootstrap policy creation by giving them templates around policies that they can use and build. So,
Wow, I think back to when we started, when I started my health tech startup in 2013, and I wish I'd had that then. I mean, because just trying to convince a prospective client customer that that our tiny little startup was low risk was incredibly hard, particularly as it was a secure communications product.
yeah, it is hard. It's complex, and there's a lot of approaches that have been out there for several years that are valuable, but they're also a bit antiquated in their assumptions, right? And specifically, what I mean by that is, these certifications that get done and cost a lot of money and take a lot of time to do, and by the time they're done, they're out of date pretty much. And risk really has to be done
Mm.
much more frequently, much more real time, much more continuous. So this notion that I'm going to go out and do a SOC 2 audit, which again is valuable, but can cost a startup
Oh,
$60,000 to
oh,
do.
yeah,
I mean, that's incredible. And for what? A piece of paper that says, I've got all of these areas that I might have to fix over time and remediate.
yeah,
Uh, but I'm gonna have to do it again for another 60 grand. I mean, it just it as I said, this is not just a technical problem, it's an economical problem on both sides, right?
right.
On the provider side and also on the vendor side. And that's what makes it so exciting and difficult, quite frankly, because we're creating this two-sided network that requires us to build both sides you know at the same time, right? Sort of the chicken and egg situation. And but as you build those connections and as you build that deep understanding of that process and workflow and the content, um, and additional data that you can actually create from those learnings and from those interactions, you're effectively creating a moat.
Yeah,
And so what we're finding is that this ability to go deep into healthcare is really helping us. And when I say deep, third party risk most people think of as suppliers, right? I'm going to buy this cloud application, I'm going to assess the risk of this medical device, and I'm going to deploy it, and then I may, if I have time, I may reassess it every year or periodically based on how critical it is to my operations. And that's certainly a vector of risk, and it's an important vector, and it's sort of our tip of the spear, if you will. But there are other scenarios in healthcare that are third party, but don't really um, represent or reflect a traditional third party scenario. And I'll give you a point in time. I'll give you a couple of examples. So you have this notion of information exchange, right? And that could be a one time event, it could be for research, it could be for a number of different use cases. And that requires a very special set of assessment workflows, but also questionnaires, right? Questions that you would guide those participants through. What happens when you're affiliating with a practice and you want to assess the risk of that practice? That's a third party, but not in the traditional sense of a supplier. So there are many examples like this that we pull in from our customers, and then we codify into the platform, and then we enable. So we're really consolidating all of these aspects of risk management within the organization under that single pane of glass. And we're leveraging the not just the knowledge and experience, but that significant understanding, deep understanding of healthcare, and the and the myriad of use cases that are risky and that require this assessment process, and that's really exciting to our customers, but also very valuable. And a traditional or a general solution in this space that has to support not just healthcare, but maybe manufacturing and banking and petroleum and gas and all of these different industries, transportation in the airline industry or whatever. They're never going to go deep into healthcare.
Right.
Because they can't. They have to service all these different industries. So that horizontal solution is going to provide a level of features and functionalities, but it's never going to deliver that deep set of value that a health provider needs to really run
Well,
their
it is a
to run their
unique,
business.
it is such a unique industry. If you could go back in time and give yourself one piece of advice, what would that advice be?
Jeez. Buy more Amazon stock.
Well, how about well, that would save you having to be an entrepreneur. But no, as an entrepreneur, what would that be?
I'm joking around.
Yeah.
Oh boy. I think I think I would have reached out. I think most, I think like many young people, right, that start off in roles, and everyone's got a sort of a different path, and everyone's got a different approach to things. But um, I kind of entered into into technology in a very unique way. So I was going to I was attending a college that was basically it's Bentley University now. It was Bentley College at the time, but it's basically a school for accountants, right? And I was not an accountant, and nor would I ever be an accountant. I'm a by trade I'm a writer, and so I went to the school and ended up taking courses around business writing and marketing and things of that nature. And so when I was looking for my initial job, one of my advisors said, there are these companies in the Boston area, in the Massachusetts area, that they call them startups, and they're looking for technical writers to communicate their products in the forms of documentation. So I'm like, okay, well, that sounds interesting. I like technology and I like to write, and so that's how I kind of started out. And then I quickly realized that um, I had a knack for seeing how markets were going to change and move, and quite frankly, it was very intuitive at first. And I think that what I would have done differently is I would have spent more time really tuning that, if you will. It wasn't until about 10 years after I got into technology where I had the confidence to really leverage that in a in a much broader way. And so I think and that confidence developed by really having the ability to and the good fortune to work with great startups, with great executives that became mentors and friends, and people I work and still talk to today. and they really helped guide me. And I was a little bit of a I was a little bit of a loose cannon. I still can be very passionate and very outspoken about things, a little bit of a bull in the china shop. And they really helped me navigate the corporate world, if you will, um, and build that confidence, to leverage my my insight and my ability to see these trends at a market level.
Well, that's great. Thank you. That's a really, really, really wise word. So, Ed, it's been really great speaking with you today and hearing the story about Censinet, how you got started, how you got feedback from prospective customers and past clients to help you shape the business. And I think there's some really interesting lessons for any health tech entrepreneur. So, thank you very much for your time today, Ed.
Thank you, Adam.